Good morning, BSRT2 students. So welcome back to our virtual classroom. Here in our subject, this is RT213 Principles of Imaging. This morning, we are going to discuss optical density. So I would like to emphasize again, optical density is one of the important aspects, especially in the principles of imaging. We are dealing with radiographic image. So, importante sa usa ka image, yaon siya density. Okay. So, let me start with the discussion by asking idea from you. So, think of someone or something that is associated with the color black. Okay, sige nga, mag-isip kayo in a matter of 5 seconds. Okay, so ito yung mga naisip kong examples. So, pag black, ito talaga yung mga una kong naisip. Of course, nandun yung Men in Black. Si Agent J at saka si Agent K, di ba? Of course, another is the Black Mamba, Kobe Bryant, di ba? Ano pa? Okay, of course, the Black Shoes. Okay, so diri kompleto tayo pagiging estudyante kung diri ka mo nagsulot in black shoes. So nano pa? Uring, of course, wala pa makumitan uring nga color white, color yellow, black good siya. Shadow, of course, parang siguro mga disco lights lang ito makakita kan mga pink or blue nga shadows, pero mostly mga black matte shadows, diba? So, we can say that black is really important, diba? So, here, optical density is related to the color black. So we can say that, bisan nga ni iyo Radtech Day, you prefer to use color black na t-shirt. Because whether you like it or not, black is beautiful. Agree ka ba kay Black Barbie? So, kinbutaan ko ng period para what I question. Black is really beautiful. So black is important in art, and we said that radiography is both an art and a science. I think Mr. Chan would agree with that. Importante with the color black. So about the details and all siguro. Sige, let's talk it about later. Okay, so yun, yung sabi ko nga, black is really important in radiography because we have the term density. So density is given a general definition of the blackening of the radiograph. But it's wrong to say may whitening of the radiograph. Dere man siya sabon. No? So iba ito, what you are thinking is siguro the contrast, but we have a separate definition on that. But definitely, it's not the whitening of the radiograph. So, the blackening is a result of processing the latent image or the invisible image into a visible image. The amount of exposure reaching the film determines the amount of density on the finished radiograph. So, probably would think, ano na daw lako ng X-ray film tanan white? Diba? So, it's very impossible for us to see the details of the image. That is why we would like to emphasize again the importance of the color black, especially in radiography. So, in radiography, definitely we avoid discrimination. Another thing is, density is the characteristic of a radiograph that is described as photographic or optical quality. So, take note of that. So, along with, iga-advance ko nala ka mo, along with the density, another photographic or optical quality is the radiographic contrast, by which we are going to discuss next week. Okay, let's continue. A radiograph is a permanent photographic record. So, the presence of density and the many different levels or density levels across the surface of the film make the image visible. Okay, so without the proper density, the other factors of definition may lose their significance because the film is useless. So, importante ang density kasi nga sabi nga natin this is a photographic or optical quality. So, we have mentioned about the definition or the detail of an image. Kaya nga, because of optical density, we can really appreciate or we can, the doctor can really diagnose what's wrong with the patient. Kaya nagpa-undergo siya in radiography. So, this one, what you can see in our illustration is a work of my BSRT2 student when I was not yet connected to UEP. So this is from my former institution where I worked as an instructor, Holy Infant College. Okay, so I can say my student gave right amount of optical density kasi nga, as you can see, medyo malinaw na yung detail ng anatomy of the patient. What else? So, density can be measured. Okay, so it's not to say it's black, so good na siya. So, there's the proper amount of density that should be present on the radiograph. Okay, so here we can say that black is beautiful, but it should be on the moderation. Sa ring panikatrio na gray, anything is good, but in moderation. Okay, so we have an instrument here. The densitometer contains a light source with a known amount of illumination. So the light source is covered with a translucent material containing a very small pinhole, as you can see. Okay. So the area of interest on the radiograph to be measured is placed over the pinhole, and the reading probe is placed exactly on the area for measurement. So the instrument then reads the amount of light passing through that radiograph at a specific point of interest. Then the readings are recorded in logarithms. It's sad to say that we don't have yet densitometer in our institution, but we are trying our best that we can acquire one of these days densitometer. Siguro pag magbalik na it face-to-face sessions. Char. Okay, so again, black or the presence of optical density on the radiograph is measured with the use of densitometer. So may computations yan, class. So for measurement purposes, radiographic density is defined as the logarithms or base of 10 of the ratio of light hitting the film to the amount of light transmitted through the film. So as you can see on the right side of your monitor, so we have our equation. So L sub 1 represents the light hitting the film and is known as standard. Okay. And L sub T represents the amount of light transmitted. So with the use of densitometer, one may measure the density levels on any area of the radiograph. So we have our formula, OD or the optical density is equal to logarithm of 10, diba? Base natin is 10. So L sub O or L sub I, that's the incident light, and the transmitted light. So, we don't have to go deeper naman kasi, anyways, we don't have yet the apparatus. So, what we are trying to inform you here is the optical density itself in the radiograph is measured. So, optical density is measured in terms of logarithms of the incident light to the transmitted light on the radiograph. So, kung anon makuha nga measurement to a certain portion of the radiograph, so we are going to find the optical density with the use of this equation. But we don't have to do it for now. So in medical radiography, optical density readings are most useful between 0.25 and 2.0. So ang pinaka-detailed na images on a radiograph lies with optical density between 0.25 to 2.0. So remember that these numbers are logarithms, so the range is very broad. A reading of 0.25 is an area that is almost clear. So with very little blackening, an area with 2.5 reading is an area that is almost too black for one to be able to visualize many structures. So yun pala. So 0.25, may pagka-appearance pa siya ng glass. Okay, so 2.5, posible na siya parang sonography. Oo. So ano na siya, medyo black na, masyado ng pagka-black. So based on Bushong, high quality glass has an OD of 0. Yun. So ito yung mga pinanggagamit siguro nga baso ay balay kasi transparent siya masyado. The light will just pass through. So it has an OD number of 0, which means that all light incident on such glass is transmitted. Unexposed radiograph allows no more than approximately 80% of light photons to be transmitted. Okay, sabi dito, unexposed, meaning waray interaction of radiation. Kumbaga, fresh nga film, imo siya yung process, of course, yung mag-a-appear is color blue lang. So, most unexposed and processed radiograph film has an OD range of 0.1 to 0.3. Wala lang, trip-trip mo lang siguro, nagkuha kahin film ha box, tapos gin-develop mo. Of course, gusto mo i-measure an optical density, so the measurement based on the computation of the logarithm of 10, so it will give you a value of 0.1 to 0.3 optical density corresponding to 79 and 50% transmission respectively. So ganun pala siya class, hindi pala siya ganun pala siya complicated sometimes, ano? Hindi lang siya kay black, ganun. So there are measurements. And remember the important measurements or optical density readings are from 0.25 to 2.0. So below that, masyado nang clear ang film, hindi na acceptable ito yung optical density. Above that naman, so masyado nang high, hindi na gihapon acceptable ang yung optical density. Ano? So again, we would like to emphasize that blackness of a radiograph is that important. Okay, so radiographic versus tissue density. Okay, so we're talking here about density, but do not be confused. So it is important to differentiate the word density as it is used in medical sciences. So density is also used to describe the nature of tissue, such as bone, characteristic of contrast media, and foreign bodies. So the bones are denser than muscle. Tissue of greater density such as bone require more exposure in order to visualize the markings and characteristics on the radiograph. Okay, so tissue density, kumbaga, the composition, simplified na lang, the composition of a tissue, kumbaga compact ba siya? Okay, so easily siya nape-penetrate. Okay, so less dense kung easily nape-penetrate. Kung hard, most dense na like the bone. So this tissue density is also applicable in other field of diagnostic medicine, such as in ultrasound. So the basic reason why diri kita nakakapag-perform ultrasound on the stomach, kasi nga aerated tissue siya, nagpa-pass through lang yung sound, diri na bounce back, di ba? Kasi less dense. So, sa bone naman, hindi siya makakapag-perform kasi nga most dense siya. Waray sound nga makakapass through for the sound. Ganon. So, it is important for us. Kaya nga sabi dito, it is used in medical sciences to describe. So, CT scan gihapon, may mga tinatawag ita nga mga CT numbers or CT value o Hounsfield units to assigned to different tissues in the body. Okay, so here, do not be confused. Radiographic or optical density. So we are talking about the blackening of the radiograph. And the tissue density, we are talking about the composition of the anatomy of interest. Okay. So in radiography, we categorize tissues into 5 major groups. Okay, so based on the composition, tissue density, based on the composition. So we have aerated tissue. Aerated meaning with air. Fatty tissue, Of course, alam nyo na. I-explain ko pa ba ano't fatty tissue? Water, bones, and teeth. So, yun ha. So, 1, 2, 3, 4, and 5. So, aerated tissue such as the lungs has the least tissue density and requires a small amount of exposure to record the appropriate level of density. Fatty tissue is the next to the lowest level of tissue density. Third is tissue with a high water content such as muscle. Okay, next, bones and teeth are the most dense tissues in the body and require the greatest amount of exposure to record appropriate density levels on the radiograph. So based on these different densities, so we can say that they require different amount of energy, such as energy of X-ray na ma-penetrate, ano? Okay, so for example, sabi nga dito, pag aerated tissue, so lesser lang yung amount ng exposure. So, which is different pag din naman sa bones. Kailangan great amount of exposure. So, we would expect that our technical factors on the console may vary from these different types of tissue density. Ano po? Sige, hopefully nakukuha ninyo akong correct signal, ano? So, I wish you could try this at home. Oo, simple experiment man lang niya. What you need is flashlight. So we have acetate or cellophane, tapos ice water, and then paper. So, observe the transmission of light. So, you will direct the light. So, ipapas maagi ang light sa acetate, sa water, and then, i-direct gap niyo sa piece of paper. Sige daw. In 5, 4, 3, 2, 1. Okay, very good. Sige. Ano na yun na-observe? So, nag-pass through ba? Same ba ang pag-pass through ang light, ha acetate, ha water, nga na paper? Okay, so probably not, ano? So, siguro, you will conclude that iba ang pagpasan light at different medium. As mentioned kanina, acetate, water, ngayon paper. So, we have a term here. We call that attenuation. So, by definition, this means a reduction in the strength or force. So, iba ang ang pag-agihan light, acetate, and water, and labi na paper. So, this is the reduction in the intensity of radiation as it passes through matter due to absorption and scattering. So, consider natin ang light emitted from the flashlight as radiation. And let us imagine those acetate, paper, and water as types of medium in the body. So, we can say that the attenuation or the reduction of the strength or force is different in these different types of medium. Okay, sige nga. Ayan, nakikita niyo yan, our illustration. Okay, so, for example, okay, so, iba-iba ang i-approach handball. So, kumbaga bone. So, bone lang malakas. Okay, parang wala lang. Water, parang medyo may na siya, may nararamdaman na. How much more sa fats? Labi na air. So, attenuation causes radiograph to represent the body part in terms of different tissue levels. So, without attenuation, the result or the end result would be a film with the same density levels across the entire surface. So, halimbawa, nag-x-ray ka mo chest. So, so, lungs, okay, and the heart, and of course, may mga ribs. So, gintagan mo siya same factor, same KVP, same MAS kay chest man mo gina X-ray. And then na-observe nimo sa imo chest radiograph, may didto an bone nagko-color white, of course an air color black. Kasi nga with pag-agihan radiation sa bone, hindi pa siya masyado nakapenetrate, kaya color white pa siya. Okay, so pag-agi niya air, kasi nga mas madali ang penetration na air, so nag-appear siya as color black. So ganon it property, ganon it impact heat attenuation sa radiograph. So depende tiya agian it medium, so may niya representation na color sa radiograph. So ito yon. Okay, so as the X-ray photons travel through the body, they are attenuated or absorbed by the tissue structures. So the photons or the photon beam emerges from the body to strike the film. It is no longer a uniform beam like the primary beam. Areas of the beam with almost complete attenuation produce very little radiographic density, and the parts of the beam with very little attenuation produce areas of greater optical density on the finished radiograph. So again, almost complete attenuation produce very little radiographic density. As I've been saying, kung nag-agi siya bone, kaya normally makikita mo ha X-ray, okay, white it appearance it bone. Not unless i-reverse mo, ano. Okay, so white an appearance and bone, ha, usual nga X-ray or radiograph. Pag sa air naman, very little attenuation. Oo, madali kasi nakaagi ang radiation. So, areas of greater optical density. Kaya normally, magpa-chest X-ray, may imod mo, okay, so color black an appearance and lungs. Kasi nga air siya. Ang ribs naman, white siya kasi nga bone siya. Mahina yan attenuation. I do hope nagigets niyo ta akong karagsingon na. No, if you have question, you can reach me naman through different platforms. Okay, so ito yung nagawa nating experiment. I gave mga I assigned the different medium kanina. So may paper, so yung ice water, and then yung acetate. So I assigned the paper as a bone. For example, sa skull X-ray, kasi nga sa kanina, when I direct the flashlight sa paper, walang attenuation, walang light na nag-exit sa paper. Kaya, interpretation natin yan, it will appear as white lang sa radiograph. Sa, sa ice water, I assigned that as, soft tissue. For example, sa mammography or X-ray ng breast, kaya may appearance siya ng okay, so may mga attenuation naman, but there are portions na may nag-pass through lang yung radiation. Kaya halimbawa, okay, so may kita mo iba-iba yung density. And of course, I assigned acetate sa lungs kasi nga nag-attenuate, nag-pass through lang ng ang X-ray, walang attenuation. Kaya color black. So the degree to which the body parts attenuate the beam affects the density. So bone attenuates the beam more than muscle or fatty tissue. Kaya areas of the film under bone receive little exposure and therefore have less radiographic density. Kaya nga color white lang siya sa radiograph. Okay, so lung, tissues, and gas in the intestinal tract attenuate the beam much less and are demonstrated by darker areas on the radiograph. So, sa radiography, ang tawag natin dyan pag white portion, so we term that as opaque. O-P-A-Q-E. Pag black naman, tawag natin dyan lucent. Okay, L-U-C-E-N-T. Kaya nga, do not be, parang ayaw nakapausa. Kung may mababasa ka mo mga chest X-ray result or X-ray result, may makabutang dito, may interpretation dito ang radiologist. There is an area of opacity. So, sabi doon, may mga white areas daw. O, di ba? So, may halimbawa, masugad dito ang report. Areas of lucencies are noted. Lucent. So, meaning, may mga black areas na na-note. O, di ba? So, Pwede gyapon naton iba kasi para mas radtech and appear or appearance. So, ginti-term ito, maswad ito, radio opaque. Tapos, ang iba naman, masugad, radiolucent. Yan. So, yun, may ka mo bago nga terms na magagamit. Pag white, halimbawa, sino ba it white na iyo classmate? So, for example, na latak makilala mga lalaki of, I will, Mr. Junel siguro, okay, Fernandez. So, kuan pa siya, radio opaque, o diba? So, sino ba't mga medyo it black complexion na nga da? Siguro, si Mr. Chan. Okay, so pasasugad ko, radiolucent. O, di ba? Balitaw. So, ayun lang pagdulo ha. It's just an illustration. Opaque versus lucent. Pag white iti appearance sa radiograph, that is radiopaque. Pag black iti appearance sa radiograph, radiolucent. Kaya nga, it's based on the property of attenuation. Pag na-attenuate masyado, of course, white na. Pag nakapass through lang yung radiation, black pa siya. Okay? Sige. Okay, so what controls the optical density sa ating technical factors, di ba? So, sa atong overview of technical factors, Module 4, so we have discussed 4 technical factors. So, we have KVP, MA, exposure time, MA and exposure time combined forms the MAS. And we have the source to image receptor distance or the SID. So, yung yung density will be controlled sa ating, normally sa console. Okay, sige, basahon natin. Density on a radiograph is primarily controlled by milliampere seconds or the MAS. So, based nga sa ating overview ng technical factors, MAS is now combined milliampere and the exposure time in terms of seconds. So distance can also be used to control density. However, distance variables are eliminated as much as possible to help produce consistent results. Distance is standardized in most radiology departments and eliminated as a controlling factor for density. So changing the distance is not practical because the image definition would also be affected. So, yung distances kasi sa radiograph, okay, sabi nga natin noon, so we have the 40 inches na SID and we have the 72 inches SID which is dedicated for chest teleradiography. Pag mga Baki procedures, so that is 40. So, makita nimo, imo Ma'am Camille, gina-x-ray mo sa radial, so nag-employ siya ng 72 inches SID. Kasi nga, chest x-ray yung procedure. Okay? So, again, the controlling factor is MAS. Ito siya. So, the more photons on the beam exits the body, the more exposure the film receives. Okay, so may low MA versus high MA. So sabi nga, more photons available as the beam exits the body, the more exposure the film receives. So as the MAS is increased, the X-ray film receives more exposure. So the sensitivity specs in the film emulsion will attract more silver ions, and when the film is developed, the more amount of black metallic silver deposits will increase. So this produces an increase in blackening on the radiograph. Therefore, the higher the MA or the MAS, the higher is the optical density. Ano? So ito lang kasi yun, class. Changing the MAS in the radiograph is the radiographer's prime method used to control the blackening on the film. The MAS is the factor that controls the number of photons in the X-ray beam. The relationship between MAS and density is directly proportional, which means if the MAS is doubled, the amount of density recorded on the film is also doubled. If the MAS is reduced by 1/2, the amount of density recorded is reduced by 1/2. Let's say, for example, for every one bola na ipinapasa, nasasalo mo, okay, waray good mintis, What if pasahan ka ng maraming bola? Eh di wow, di ba? Ganun din. Sa isang MAS, oo, so na ibinigay sa X-ray kasi nare-receive, nagbablock na siya. How much more kung lagyan siya ng maraming MAS, 'di ba? Yung tendency ng pagiging black niya is talagang ganun nakalakas, ano? Ganun naka-appreciated yung pagiging black. So ganun yung effect ng MAS sa optical density. So the maximum density level that is photographically useful again is 2.0 kasi sabi nga natin kanina that is from OD values of 0.25, 'di ba? 0.25, sorry. Wag na lang. 0.25 to 2. 'Di ba? So yung maximum is nasa 2.0. Measurements of 3.0 plus may be obtained, but at this level, it is not important to radiographer. In photographic range, to see a visible difference in density of a radiograph, one must increase the MAS by at least 30 to 35% to see a visible change in the density. Okay? So, for example, this is the optical density na na-produce ng X-ray film mo. So, yung reading niya is nasa, ano lang siya, let's say, nasa 0.20. Gusto mo i-increase. So, mag-i-increase ka ng MAS para ma-reach mo ito. So, yung gagawin mo, kailangan mag-a-add ka ng 30 to 35% ng original MAS mo para may makitang changes sa optical density. Ayun. Sige. Ayun ha. Next. Okay, next we have the kilovoltage and the density. So, nako-control pala or may effect din pala ang kilovoltage sa optical density. So, it is important to understand that although MAS is the primary factor used to control density, kilovoltage changes can also significantly affect density on the film. So an increase in kilovoltage peak will result an increase in density recorded on the film. The relationship between KVP and the radiographic density is not one of a proportion. So hindi tulad kanina sa MAS, if mag-double ka ng MAS, magdo-double yung density, mag-half ka ng MAS, magiging half ang density, hindi ganon ang epekto ng KVP na pag mag-double ka ng KVP, magiging double ang optical density. Pag mag-half ka ng KVP, magiging half ang optical density. Again, X. No, hindi ganon yung epekto niya. Ito yon. So, the 15% rule, so, i-open na lang natin muna, i-advance na lang natin muna class. So, may 15% rule pero i-reserve lang muna natin yung mga mathematical equation nito when we discuss the kilovoltage. So, the 15% rule is used to predict changes in the density levels with KVP. So, an increase in KVP by 15% will approximately double the overall density on the film. So by using this rule, a change of more than 10 kVp would be needed at higher kVp settings, whereas at lower kVp settings, a small changes of only 4 to 5 kVp may be needed. Okay, ganito yung class. Example, ganito yung na-attain mo na image on your radiograph. And gusto mo siyang mag-appear pa ng slight blacker pa siya, no? Iuulitin mo yung procedure. So, what you are going to do is that you are going to add 15%. So, halimbawa, 75 yung original KVP mo, kukunin mo yung 15%. And then, i-add mo sa original na KVP. So, you would expect na magiging ganito yung appearance. Halimbawa, inulit mo, tapos nagbawas ka ng 15% sa original KVP, you would expect magiging ganito yung appearance. Okay, so that is based on the principle of or the 15% rule. But sabi ko nga, i-reserve lang muna natin. Yung actual mathematical equation will be discussed when we talk about the technical factors na, the KVP and MAS. Kasi pair ito eh. Hindi lang to, not just about KVP. Kasi may adjustment din to. If you want to just raise the contrast, not the optical density, meron niyang computation. So at least, open na ang inyong mind, open-minded, sa aspect or sa concept ng 15% rule. Maganda yan, at least may idea na kayo about sa 15% rule. Okay, so when KVP is increased, more scatter radiation is produced, which adds density on the film. Scatter will also produce more fog across the film. When only a change in density is required to improve a radiograph, the most effective factor is milliampere second. So, halimbawa, gusto mo itong madagdagan ang density, adjust ka na lang sa MAS, not on the KVP. Kasi nga, sabi nga dito, mag-a-add lang siya ng scatter radiation, which is not helpful in the way of diagnosis. Okay? So, kaya, masasabi natin, based sa dalawang technical factor na na-mention, the controlling factor for optical density is the milliampere second, whereas the affecting factor for optical density is the kilovoltage peak. Okay? Okay, so dapat tandaan mo yun ha. Which one is the controlling and which one is the affecting. But the other way around, when we mention about contrast, the other photographic factor or the quality factor, the contrast, may effect ba si MAS sa contrast? Hindi natin alam. Okay, malalaman natin next time. So other factors that affect the optical density, of course, the anode Hill effect. Diba? So X-rays originate from the focal spot area and travel in all directions. So the physics of X-ray production demonstrates that a more variation in intensity is present when one measures the intensity on the anode and the cathode side of the X-ray beam. So the intensity of the beam is less on the anode side of the beam. So na-mention na ito natin the last time when we talk about the X-ray tube, that there is a variation, no? So it from the central axis of the X-ray beam. Kaya nga, as a result, to overcome the density changes that result from the anode Hill effect, the radiographer places the thicker parts under the cathode side of the tube. So with thin body parts under the anode side. Longer SID and smaller field sizes will reduce the consequence of the anode Hill effect. So hopefully, before kasi nag-lockdown, I posted several questions about the anode Hill effect. Hopefully, mapansin nyo ulit yun. That is on the module 2. So, hopefully, ma-answer natin yun. So, on the radiography kasi may direct bearing yung placement ng thicker part of the anatomy kasi nga based on the anode Hill effect. Anode Hill effect, kailangan yung thicker part of the anatomy should be directed towards the cathode. For example, sa chest x-ray, so sabi nga ng references, mas makapal kasi yung parts directed at the diaphragm compared sa apices or the superior portion ng lungs. Kaya when we perform chest radiography, the direction of the cathode is towards the feet or caudally. Nandun yung position, ang placement ng cathode nandun sa baba. Nandun kung saan ang position ng diaphragm. Yan. Again, so that's anode Hill effect, another factor na nakaka-affect ng optical density. Next, of course, the equipment, calibration, and operation. I hope hindi kayo nagsasawa sa picture ni Sir kasi ganyan lang. Ito lang ang picture ko nang mag-calibrate siya ng X-ray machine. So, maintenance of the X-ray equipment is necessary for consistency in exposure. Density can be severely affected, plus or minus, by poorly calibrated equipment. At the time of exposure, radiographers must be able to determine if full exposures are obtained. So the recording of proper density depends on the knowledge and skill of the radiographer in the use of the X-ray equipment. Actually, when sa calibration kasi, itatanong yan. Ika-calibrate nyo yung machine, tapos mag-expose kayo ng film. Kung satisfied ka na sa kuha, okay na yung calibration niya. Pag halimbawa, sinabi mo na increase pa yung ganong technical factor, i-increase niya, tapos ganun na yung magiging takbo ng technical factors mo niyo sa inyong radiology department. Kaya important na dumaan muna sa calibration. At during calibration, mas maganda kung ikaw na radtech nandoon ka para ma-assess mo yung mga gagamiting technical factors. Okay? In your department. Next, of course, is the time, temperature, or the processing of the latent image. This is on the darkroom side. Maganda yung pagka-position mo. You place the thicker part of the anatomy sa cathode side. Maganda yung calibration. Maganda naman yung MAS mo. Nandun na yung distance, pasok sa KVP. So, isa pang importanteng factor na dapat nating malaman. In fact, dito nag-struggle yung mga estudyante ko noon when they had their laboratory sa processing of the latent image. So, the time-temperature relationship is more important in processing radiographs to show optimum density. Solution temperatures that are too hot will increase density, and the temperature that are too low will produce radiographs with insufficient density. As well as contaminated processing chemicals and improperly prepared chemicals can also affect density levels by increasing fog levels which are undesirable on the film. Ito yung mga namimiss kong experience with my BSRT students when they had their laboratory. Kasi nga, sabi ko kanina, ito yung part ng radiography kung saan mostly they are struggling. Ito, solution temperatures, diba? Pagbago kasi, halimbawa, bago ang inyong relasyon, bago kayong magjowa, hot pa kayo, you're excited to see each other, pero pag medyo nagtatagal-tagal na kayo, nagsasawaan na, ganon. Hugot na naman si sir. Actually, hindi ko naman alam, wala naman akong relationship. So, solution temperature, pagbago, it's hot, kaya decrease mo yung mga technical factor mo kasi madaling mag-react yung X-ray film. Pag luma-luma na, masyado nang mabagal kahit minsan nagtatagal yung estudyante ko 5 minutes, 30 minutes kada develop ng film kasi nga luma na yung processing solution. Kasi depende kasi yun class sa dami ng na-develop yung film. Halimbawa, you are manual processing like yung nakikita nyo sa illustration, may developer, may fixer. So, manual processing pa. So, depende kasi sa dami. For example, you are entertaining or catering 100 patients per day, hindi yan magtatagal ng 3 months. Pwede yung pang 1 week lang na solution, palit na naman the other week. Kasi madami yung pasyente nyo. Depende sa dami ng film. Kung hindi naman madami yung pasyente nyo, depende sa time. Maximum kasi niyan is nasa 3 months lang na paggamit. Actually, yung 3 months na yan, medyo dudable na tayo kasi nga yung temperature. Kaya, mas maganda every month, change ka ng solution whether ginagamit or hindi. Yun. Diba? Another thing is yung contaminated processing chemicals. Kasi nga yung ibang estudyante ko noon, very much excited mag-develop ng film sa darkroom. Especially nung iniiwan ko na, I let them develop the film. Excited masyado. Instead na sa developer muna, i-dip yung film, yung ginagawa nila, inuuna sa fixer. And what would you expect? Wala na. Lusaw na, na-extract na lahat ng silver, metallic silver. Kaya, kahit i-reverse mo from fixer going to developer, what happens is wala na talagang lalabas na image. Nakukontaminate mo lang yung processing solution. Kasi hindi yan dapat class na from fixer, pupunta mo sa developer. Kasi nanu-neutralize siya. Ma-deactivate na yung chemicals ng developer. Kaya the process should be from the developer going to the fixer. Ayun. Sige. I hope matapos na yung pandemic so that you can experience kung ano yung mga na-experience ng previous BSRT2 students, especially in this subject, the principles of imaging. I was expecting na natapos yung pandemic sana at nag-enjoy kayo sa ating subject na ito kasi nga dito primarily ma-open yung inyong eyes, especially sa mga dark room na, di ba, mag-a-adjust na yung eyes nyo from exposure to dark room. Kaya, sad to say, nasa pandemic tayo, wala tayong laboratory. Okay lang yun. Next time na lang. Next, of course, is the film type. So, film types that contain increased amounts of silver halide crystals will increase density. So, care must be taken by the radiographer to prevent overexposure or too much density. Slower film types build less density and require an adjustment in the exposure factors. Radiographers must be aware of the film type that they are using to produce the radiograph. So, sa sa specifications naman ng box ng marireceive nyo sa inyong department, may mga may mga manufacturer's specifications kung ano yung mga contained na silver halide, tapos kung ano yung appropriate na speed ng intensifying screen, okay, anong combination niya para mas maganda pa rin yung labas ng inyong optical density. Ang kalimitan kasi, class, yung nangyayari, halimbawa, hindi match yung intensifying screen at saka yung film, medyo nagkakaproblema tayo sa dark room. Pag hindi match, halimbawang ganun yung usual na factor mo, yung usual KVP, usual na MAS, ganun yung binibigay mo. Pag develop mo, hindi pa rin siya nagbibigay ng optical density or ng image, hindi pa rin nako-convert yung latent image into manifest image na pasok sa optical density, kaya natatagalan ka sa development process. So, yun. So, kailangan, basahin mo muna yung specifications ng manufacturer, kung ano yung gagamitin niya or level ng emulsion, at saka yung speed or yung tawag nito, sensitivity ng X-ray film, na kung bagay ba siya sa intensifying screen na available sa inyong department. Of course, kung magkakaproblema sa film, posible din magkaproblema sa screen. Kaya isang factor na nagko-contribute ng optical density is the screen type. Intensifying screens increase density on the film by intensifying, the action of the X-rays. As the screen speed increases, the density will increase. Therefore, less exposure will be needed to keep density at appropriate level. Speed of the screen and its impact on density are important factors with rare earth systems, which are much faster than calcium tungstate screens. The reduction in exposure necessary with rare earth screens greatly reduces the amount of radiation exposure to the patient. Yun, yung sinabi ko kanina. Kailangan ma-assess mo yung spectral matching ng film at saka ng intensifying screen. Kung talagang match ba yung emission ng light ng intensifying screen at saka yung sensitivity ng film, kung match ba, di ba? Other than that, i-check mo rin, baka minsan hindi na ganun ka close contact. Pagka-close mo ng cassette, walang contact yung dalawang layer ng intensifying screen, so posibleng magkaroon tayo ng problema doon. Okay. Next is the characteristic of tissue. Yun yung sinabi ko kanina, class. We have the radiolucent versus the radiopaque tissues. Again, radiopaque, appearance niya sa radiograph is white. Yung radiolucent naman, appearance niya sa film is black. So the structure and composition of body tissue may affect density by changing attenuation. More dense or compact structures will absorb more of the X-ray photons as they pass through the tissue. Less radiation will exit the part to strike the film, and the density will be decreased. Soft tissue, such as the anatomic parts of the gastrointestinal tract, will appear or will absorb less radiation, and these areas will appear darker than the areas representing the bone. So makita nyo dito, class, yung bones are radiopaque. White siya kasi nga na-attenuate yung X-ray. Yung components ng ating GI tract are radiolucent kasi nga nag-pass through lang yung X-ray. So now, ma-appreciate na yung optical density based on the attenuation of different parts of the body, and of course, makikita na natin yung detail. Okay, no? Yan. So, I hope na you can understand, nagigets nyo yung mga pinagsasasabi ko dito. Again, if you have questions, do not hesitate to reach me through different platforms available. Okay, so pathologic processes may affect the recording of the density on the film. Okay, halimbawa, maganda naman yung technical factor mo. Maganda na yung KVP, MAS, maganda yung position. Okay, so nasunod naman yung anode Hill effect. Maganda naman yung pagka-develop. Match naman yung screen tsaka film. So, pwede pa rin magkaroon ng hindi magandang kuha. Oo. Kasi nga, nasa pasyente na pala yung problema. May sakit kasi yung pasyente. Kaya do not expect na magaganda lahat yung appearance ng film. So, pathology ng film. So, radiographers must study pathologic processes in order to understand how diseases change body tissues. Kaya may subject sa RadTech which is radiologic pathology. Matatakol nyo yan sa third year. But an overview ng inyong pathology is your medical terminology. You have defined conditions, terminologies related in the field of radiologic technology. So, to compensate, exposure factors must be decreased for destructive diseases, and exposure factors must be increased for diseases that cause tissue density. Ito yun, class. Kanina, meron tayong radiopaque. Radiopaque. So, tawag natin dyan is additive. Kasi nga, na-attenuate lang yung X-ray, so mag-a-add tayo ng technical factor. So, the other one naman, tawag natin doon yung radiolucent. Yun yung tinatawag natin ditong destructive pathology. So, in some instances, we have to decrease technical factor. Kasi nga, if usual yung technical factor mo, it will appear black sa radiograph. Take note again ha, destructive. The other one is the additive. Destructive is radiolucent. The other one, additive, is radiopaque. Sa destructive, usually we have to reduce or decrease our technical factors. Sa additive or radiopaque, normally we have to add, kaya nga additive or increase technical factors. Ito yung mga conditions na sinasabi ko. So, radiolucent, destructive. Okay, so normally these appear black on the radiograph. So, we have active tuberculosis, atrophy, bowel obstruction, cancer, degenerative arthritis, emphysema, osteoporosis, and pneumothorax. I hope you give time to define, okay, or review your medical terminologies. Ano-ano yung mga conditions na ito? Atrophy, di ba? Sige nga. Atrophy, di ba? hindi siya nag-grow, di ba? Atrophic. Oo, yung opposite nito is hypertrophy, di ba? Too much naman yung growth. Okay, halimbawa ito, pneumothorax. Pneumo means air. Thorax is thoracic cavity. Yun. So, again, these conditions are under radiolucent or destructive pathology. Yung iba, nagdi-disagree dito sa active tuberculosis kasi nga yung appearance niya daw sa radiography is white. Hindi naman to sa akin galing yung references na to. It's based naman sa book. Okay, so yung after kasi sa tuberculosis is yung mga cavity or cavities na na-produce ng tubercle bacilli, yung mga sugat-sugat sa baga that normally appear as black. Oo, so yun yung after dito kaya nakategorize siya dito sa destructive pathology. Okay, bowel obstruction. Okay, so tinitingnan dyan yung stepladder sign. Okay. Next, we have the radiopaque or constructive or what we call additive. Additive na pathology. So we have aortic aneurysm, diba? Medyo controversial to kasi nga sa pagkamatay ng very controversial trending ngayon sa Facebook na isang flight attendant. Ascites, so hindi to siya inflammation class ha, diba? This is accumulation of fluid in the abdominal cavity at meron naman tayong atelectasis, cirrhosis, hypertrophy, metastasis, pleural effusion. Ito yung common na radiopaque or additive, pneumonia, and sclerosis. So, sa ating chapter test next week, baka lang, I'm not sure, pero nagbigay na ako ng hint na baka mapasok ko to sa mga, sa mga quizzes natin next week. So, you study by reviewing your medical terminologies, the definitions of this condition. Bakit siya nakategorize under radiolucent and radiopaque pathology? Okay ba tayo dyan? Okay, very good. Of course, we have filter. Okay, so hindi lang camera nyo ang may filter. Kaya nga, hindi ko kayo masyado kilala sa Facebook. Sino ba tong estudyante na to? Sino ba to? Kasi nga, yung iba naka-filter pa yung mukha. Parang hindi ito yung mga nakita ko last time. Parang ang ganda masyado. Joke. Okay, so hopefully makilala ko kayo not just in Facebook siguro one of these days. Okay, so we have filter. Hindi to yung camera filter ha. Filters are thin aluminum or metal devices that are located between the X-ray tube and the beam restriction devices. Okay, nandito siya. Ito, masyado in-expound lang kung ano yung component nito. So makikita natin ito dito to. Ito yung portion na yan, yung filter. So, meron tayong inherent, meron tayong added. So, the purpose of filtration is to absorb the low-energy X-ray photons in the beam as they exit the tube. So, nafi-filter out. Okay, so, sinasala, di ba? Sasara ang mga low-energy photons. Kasi ito ang mga low-energy photons, they will just contribute to the patient's skin dose. Shallow penetration lang, hindi siya makaka-pass through, di ba? Attenuated siya agad-agad. So, the low energy photons contribute nothing to the radiograph. However, these low photons greatly increase the patient's skin dose and absorb radiation. To protect the patients, filtration is required. Kumbaga, yung filters, pwede natin siyang tinatawag na beam hardener. Di ba? Gin-harden. Papagahi, pwede. Matiga ang radiation kasi nga nakaka-penetrate na siya. Dirila siya kay attenuated, nakapass through na ang radiation from the body na marireceive ng image receptor. Next, we have grids or the Pathology diaphragm. So, grids are used to absorb some of the scatter and secondary radiation produced by the body part. The grid is placed between the patient and the film. Scatter and secondary radiation account for up to 50 to 90% of the density on the radiograph. Sabi natin kanina, pag mag-increase tayo ng kVp, nag-i-increase yung scatter radiation. Kaya yung mga scatter radiation na yan, fini-filter out, hinaharag, sinasara ni grid. Grids improve the quality of the film by absorbing scatter radiation. The absorption of radiation causes a reduction in the total amount of radiation reaching the film. In other words, the addition of a grid will reduce density. So the use of a grid requires an increase in exposure factors to maintain adequate density levels on the radiograph. So, in advance lang natin si grid, pero we have a separate topic on this kasi may mga problem solving to May mga changes ng technical factor na kailangan isolve muna natin using mathematical equation. Kaya, at least dito, binigyan ko kayo ng idea what is grid. So, fini-filter out niya yung mga scatter radiation. As to kung ano yung magiging increase ng technical factor, reserve lang muna because again, we have a separate topic on this. Next, we have beam restriction. Yon. Kita mo si Sir Rachel, kino-confine natin yung emission ng X-ray towards the the area of interest sa chest lang. So beam restriction devices are used to restrict the beam field size to the size of the part. So collimators are the most common type of beam restriction. Cones and aperture diaphragms are alternative types of beam restriction. Beam restriction devices reduce the field size and the actual area exposed on the patient by primary radiation beam. So as the field size decreases, smaller areas are exposed and less scatter radiation is produced. The result is less density recorded on the film. So ito yung mga usual na ginagamit natin. This is the automatic collimator. Yan. Ito, pwede nating may replace yung diaphragm or rectangular collimator at saka ito yung cone. Okay, sabi dito, if ma-restrict natin, if ma-limit natin yung field size, okay, nagdi-decrease yung optical density because nalilimit natin yung scatter radiation. Diba? So, less scatter radiation, therefore, less optical density on the film. Kasi nga, too much optical density is not good. Diba? Yan. So, next is fog. So, all types. Pwede siyang sa development fog, sa scatter radiation na fog. Yon. Fog is increased or unwanted density on the radiograph. It is undesirable and detriment to the quality of the film. The main source of fog on the radiographs is scatter radiation. Kaya yung design ng darkroom mo should not be nasa likod ng vertical grid. Okay. So, halimbawa sa ating laboratory, kung mapapansin nyo, hindi ito yung dark room. Nandito yung dark room. Kaya to prevent the occurrence of scatter radiation fog, kailangan yung direction ng X-ray beam mo hindi towards the dark room. Diba? Oo, para hindi mo expose yung mga fresh na film na nasa dark room. Otherwise, yung iba naman may tinatawag na development fog. Yung nasobrahan kaka-develop sa immersion ng film sa development or sa developer ng processing solution. Okay. So, yun na. Natapos na yung aking discussion. So, again, take note of the controlling factor and the affecting factors of optical density, class ha. Kasi one of these days or maybe next week, we will have a long test or a long quiz about this topic. So, as a conclusion, we can say that Black lives matter and definitely black matters on radiography. And this is due to optical density. Okay, so that ends my discussion. So if you have time, you may browse your notes and your book. So this is my reference for this topic. And if you have questions, do not hesitate to ask me through different platforms. And this has been your instructor, your professor for this subject, Sir Ronjel Istonilo, saying goodbye and have a nice day.